Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hello friends, welcome to a new lecture today. I would like to discuss about Desjardans gallstone forceps. So this is Desjardans gallstone forceps. How are we going to identify this? Number 1, there is no lock. Remember, there is no lock. Why is there no lock? Because if there is lock, there can be crushing or injury to the common bile duct. In order to avoid the crushing or injury to the common bile duct, we do not have lock in Desjardans forceps. There is a long distal blades, and at the end of the blade there is a fenestra, and also you will see smooth serrations. This fenestra at the tip and presence of no lock is the best feature for identifying this Desjardans gallstone forceps. What are the uses? It is used for cholecystectomy, that is for the removal of common bile duct stones. It is used for cholecystectomy for removal of common bile duct stones. Thank you for watching my lecture. Thank you.
thank you and thank you for watching.